want to bring my good friend, Dr. Joe Congini, back to the show, Sports Medicine Center at Akron Children's Hospital. Dr. Joe, where do you want to start today?
Hey, Ray. A couple of things I want to bring out, and you're always so good to me about allowing this time of year for me to tell you about our Sports Medicine Update Conference. Building Young Athletes Safe and Healthy is number 16 we have Friday. And so our 16th annual, and, we had a year we had to miss out and a year that was all virtual. And we have a hybrid model this year, virtual and in person. And the numbers are getting back up to the peak they used to be at. We get a lot of people from all over Ohio and this region of the country to come and hear some of these topics. And so I just wanted to, if anybody has interest in this, in PTs or trainers, or even we get coaches and stuff sometimes with the virtual model, we have room for people to get in on this. So Friday we have 3 of our orthopedic partners who are so great in the community that I know a lot of you know already. Dr. Kerwin Jones has been the longtime team doctor over at Copley, is talking about growth plate injuries, and Dr. Pat Riley Jr. talking about, hey, when do those ankle sprains, when they get bad enough, when do we have to fix them, and how do we fix them surgically? We talk about that on this show a lot. And our hand specialist who's taken care of the University of Akron for 20-plus years with hand injuries, Dr. Drew Engels is on the docket. But we always invite a national expert. We have a national expert this year, Ray, on gymnasts. So we usually look at one group of athletes, and we're going to focus a little bit in part of this conference on gymnastics. Gymnastics is really tough, and this is the time of year they start to shine as they get into the competitive gymnastics season of the year. And there's so many good club gymnastic groups in this area, and we see a lot of them this time of year. But what's really tough about them, Ray, is kind of knowing how we get them to return to sport. So with other athletes, we can test them. We can test soccer players and basketball players, and we know pretty well with baseball players and things. But with gymnasts, not always so easy. And the specific injuries are a little different than other sports as well. So this national expert by the name of David Tilley is a PT that we are bringing in that's going to speak to us about gymnastic injuries and a whole host of a couple of other talks that give us a whole day's worth of sports medicine. So if anybody has any interest in this conference, there still would be some openings because of the hybrid model, even though we're well over 200 again, and back up to the numbers we used to have pre-COVID, which is exciting to us in our 16th annual Sports Medicine Update. So I just wanted to bring that to the attention. We're going to have a lot of good education going on Friday, talking a lot about these things, and maybe some of what we learn we'll share with the audience in the next few weeks on your spot right here.
Joe, if you don't mind me jumping in here, because it is the first couple of weeks of baseball tryouts all around the region, and just to educate some parents a little bit, if their fellas or maybe even the girls with the softball teams and such come home with a sore arm, what's the proper way to treat that at night, Joe, if we're doing that at home for these guys?
Yeah, so soreness in the arm in throwing when you haven't thrown for a long period of time, pretty unique. A unique movement pattern, and doing it at levels and volumes that you haven't done before. Number one, check the volumes. Don't be doing too much too soon. We really have the usual ability of in our climate of doing too much too soon because usually we go very quickly from cold winter right directly into maybe, warmer spring when we're able to play. So be careful about too much too soon. Although we've had a beautiful lead in this year. Everybody's been telling me, all the spring coaches have been telling me their teams have been outside now for a week or two with the way our weather's been. But do it gradually. The buildup should be by about 20% or 25% a week, Ray. Don't do too much. And that's probably number one on the list. But if kids are coming home, if they're achy when they're done playing and they're sore, ice is still good, and get on a good stretching program. Check with your high school trainer, and I'm sure they have a good stretching program. I know everybody that works with us has good stretching programs and strengthening programs for the throwing athlete. The athletic trainers can do that for you very well. But one thing that would be a concern to me, Ray, is, and you know this, if we start getting pain that goes into activities of daily living. So when they're doing things day to day and they're starting to have pain on a daily basis, Those are the ones that, now we've tried a little bit of ice and we've tried a little stretching and strengthening with our trainer. Maybe at the end of 10 days or a week, we maybe need to have those people seen in sports medicine or primary doctor, or somebody who knows about getting kids in quickly and getting them treated early. We have a short baseball and softball season, so get on those things early, build up gradually. Remember, the ramp-up should be 20 to 25% a week. Don't do too much too soon. And those are a couple of thoughts that I'd have about the throwers, Ray.
Perfect, my friend. A lot of kids probably coming home with those sore arms, as you mentioned, last couple of weeks. Joe, good talking with you again. We'll reconnect next Wednesday.
Hey, Ray, one more thing
Sure.
is trying to get an update on our, the native son. LeBron doesn't get hurt very often. You've mentioned that before. Not a lot of information about the specifics of his foot injury, but we'll talk about that later in the week or next week. We'll probably have a little bit more information and detail on that, okay?
That sounds good to me. They're saying now at least a couple of weeks before they check on him again.
I know. It doesn't sound good, and some of the kinds of injuries that I start to worry about. But we'll know more by later this week, probably.
All right. Sounds good, Joe. Good connection, my friend. We'll talk later.